My name is Andy Sagers. I'm a Principal Client Solutions Architect here at AHEAD. I specialize in the healthcare and life sciences space. I'm located out of the Chicagoland area, covering some of the larger healthcare systems in the Midwest. And when Ron had asked me to speak, he'd asked me to kind of talk through what we're seeing in the healthcare space, specifically around public cloud and digital transformation. Because I think it's important to acknowledge, we hear the term digital transformation in the industry today, but it's not just a buzzword. We're seeing a real impact on health systems today. So first, let's talk about AHEAD. So who is AHEAD? AHEAD, we're a national integrator across 30 cities across the United States, 2.1 billion annual gross revenue. 45% of our customer base is in the payer and provider space. So we do, there's one vertical that I would say we specialize in the most, I would definitely say it's healthcare. 175 million in professional services. The reason we put this there is we like to say we're a professional services organization. We build our depth and expertise around helping organizations build digital platforms. Out of the 1,000 employees, 70% are dedicated to engineering, whether that's technical sales or delivery. We put a lot of investments in our technical subject matter experts. And out of the healthcare systems that we cover, I'd say it's roughly 60 plus healthcare systems within the Midwest and Eastern US. And then we have had several acquisitions over the past, I'd say 18 months. One of the more notable acquisitions is a development group called Platform Consulting in the Denver-based area. They've allowed us to bring our data center cloud solutions to the app modernization. So, walking the walk around application development. When we look at the healthcare systems that we work with today, we're looking at building digital platforms. So specifically around our portfolio with ServiceNow, public cloud, data center, monitoring analytics, we look at our depth and expertise around stitching these solutions together to help bring new capabilities to healthcare organizations. And then more notably, our practice around Microsoft Azure. So we are a Microsoft Gold partner, we specialize in app dev, cloud platform, data analytics, data platform, data center, and collaboration. Our services bench can cover anything around strategic services, whether that's workshops and assessments, strategy and roadmap, Azure architecture, or more tactical work around deployment, hybrid cloud connectivity, application rationalization and migration, and then more on the development side around DevOps, enterprise data warehouse, AI, and machine learning. But I would say more notably, what makes us different than a lot of other Azure shops is our depth and expertise around integrating other solutions. So whether that's HashiCorp, Terraform, Vault, Chef and configuration management, Jenkins, Puppet, ServiceNow, our depth and expertise is around stitching these solutions together to meet the digital needs for our clients. So when we talk about healthcare, I would say over the past 2 or 3 years, there has been some drivers around the digital experience. So whether that's mobile access, providing patients and clinicians or patients and physicians tablets and phones to increase the digital experience around medical records, whether that's empowering patients around scheduling, mobile access, or even providing transparency into the business side to reduce waste and cost. We've seen a big drive around digital transformation within the public cloud. I'd say it's definitely ramped up in the past 2 to 3 years. But I think, Ron alluded to this previously. If you look at one of the biggest drivers over the past 3 to 6 months, it's been COVID. And I think this is probably nothing new for everyone on the phone here. If you look at the need to provide not only just telemedicine, but there's so many other digital experiences that come along with that, whether that's the scheduling scheduling of a lab, ordering prescriptions. There's so many other digital touch points that come along with the telemedicine experience. We've seen a huge accelerant around digital transformation and digital needs within the healthcare space. So this is a slide I pulled from the talk that I did last year in 2019. And when we talk about digital healthcare, there's kind of been 2 axes that we look at. There's the business management access, which is that vertical access. It's around reducing waste, looking at non-clinical activities, real-time orchestration of resources and supplies. And then there's been that care delivery access. And, whether that's everything around the diagnosis, treatment, and outcome of the patient, if we look at digital transformation within healthcare, it's always been a combination of both, right? Most organizations are going to take one path or the other, look at, driving down efficiency or trying to improve the patient experience. But I would say, if you ask me now, post-COVID, it's probably teetering a lot more towards the care delivery side, because we've seen the way telemedicine and telehealth have driven this, and I'd probably say that chart is going to teeter more towards the care delivery side. But what we do know is all these new capabilities that healthcare systems are looking for are driving towards public cloud. It's the specialized services, whether that's AI and ML, around these different pillars, whether it's virtual care, a lot of the partners and ecosystems that health systems work with, data and analytics kind of being front and center between research, IoT platforms, wearables, or even information systems that the clinicians use. We are seeing a lot of organizations drive towards public cloud because they're looking for these specialized services like that Microsoft can offer. And when we look at kind of these public cloud use cases, I'll break them down kind of in these 4 categories. Business intelligence, which kind of goes to that vertical line around denial management. I have one organization I'm working with that is, they're building a huge enterprise data warehouse to understand where specific CPT codes are being denied with specific insurers, right? Because it's a revenue stream for them, and they want to understand, how to, I'd say, optimize the way they do billing. Population cost and prediction, fraud, waste, and abuse, RS cost variance. And then if we look at research, and Ron kind of alluded to this as well, we're seeing tremendous acceleration around genomic sequencing, digital pathology, cancer research, building large data lakes to support this. When we look at operational efficiency, we're seeing a lot of healthcare systems embrace public cloud to do census forecasting or understand patient bed scheduling. Could they get a little more efficient the way they schedule patient bed, but also get a little more efficient the way ambulatory schedules are going? So it's driving down those efficiencies to eliminate waste and reduce costs. And then collaboration. Ron said this is front and center, and I absolutely agree with him. Telehealth, health information exchange, what we're seeing with Microsoft Teams, physician collaboration, remote IoT devices. I think this is within the past 3 to 6 months. This is probably a use case that has definitely accelerated within this space. But ultimately, when you look at the application stack, so when you look at the healthcare systems I work with, and I'm not saying this is the end all be all, but when you look at the application stacks that we see today, I would kind of categorize them in these 6 patterns. And when you look at the majority of the applications that healthcare systems are using today, they are legacy COTS off-the-shelf apps. And I think most organizations aren't, they're not willing to just throw those applications out the window. They're looking to build and develop digital experiences around the existing application. So when I kind of talk about the application stack here, it's more along the lines of we're not seeing healthcare systems lift and shift every app into public cloud. I don't think most people would agree that they're not shutting down data centers and doing a traditional lift and shift. They're going to the public cloud to leverage specific services, whether that's AI and ML, or other specific cloud native services that can help integrate with their existing legacy systems, right? So they're building those digital experiences on top of what they already have. These aren't the Netflixes of the world building, cloud native applications. So when I was talking around digital transformation, he's like, could you bring me a case study? Could you show me what you're seeing? And this is one example of how we embrace legacy applications to create a digital touch point. Because what most organizations are looking to do is they're looking to develop on top of their existing systems, whether that's in EMR like Epic or other existing legacy applications. How do they create a digital touch point on top of that? So I pulled this example from a customer we work with in St. Louis who is looking to take their existing huddle boards, and I think most organizations have some form of this around the nursing station, whether it's a whiteboard, magnets, they're physically sitting at the nurse's station where they track all the tasks, not only the tasks for today, but it's also a manual repository of announcements and maybe new safety info and regulations. Generally speaking, it's limited visibility for leadership or anyone who's off shift because they have to manually walk around the floor to actually read what's on the board. And then there's no true historical tracking. And I know some of our organizations handle this a little bit differently. Some people do port some of that information to something like SharePoint or maybe even Microsoft Teams. But a lot of changes that have to be done to these boards has to be done manually, whether it's hospital-wide, new changes to rules or new changes to policy. If they have to make a change to every single whiteboard, those are done manually, whether it's done through email or traditional communication information or traditional communication systems, and then printed out and posted to the board. So what our health system we were working with wanted to do was, how do we digitize that? How do we make it more visible to leadership? How do we create real-time reporting? How do we allow a portal for maybe off-shift workers to actually log in and track progress of what's going on for the specific care for a specific patient? So the way we kind of approached it was, what if we take, sorry, let me go back. What if we take the existing legacy stock information? So in this case, some of it was tracked in SharePoint, some of it was tracked in other databases, and then build a custom dashboard that sits on top of the existing legacy app. And then the other idea is this health system was leveraging Microsoft Teams to do some collaboration, but there wasn't necessarily any governance around the way the team channels were structured. More along the lines, could they create a dashboard with reporting that then they could leverage Teams to do the actual communication? So the way we built this custom app, which is to be leveraged whether it was a tablet, a phone, or also replacing those traditional whiteboards with a digital screen to now be what we call the e-huddle board. So it's that custom-based approach that we're developing on existing systems that seems to be kind of the trend we're seeing within healthcare. So when we talk about, cloud where it makes sense, it's leveraging those high-value services in public cloud to build that digital experience on top of what per se we see some of the legacy systems. So I think, when we talk about digital transformation, it's something simple like this, and just in creating that digital touch point that whether it's physicians or patients can leverage. So I do want to give a quick commercial for ahead. If you'd like to hear more about what we're doing within the healthcare space, if you'd like to hear more about what we're doing in the app dev space, specifically around healthcare, I'll invite everyone to join us in our executive briefing center. We do host those throughout our office locations throughout the United States, as well as post-COVID, we're definitely doing these virtually. So please take down my information